I'm number 1. My name is Francis Alexander.
I'm number 2. My name is Connie Fernandez. And number 3 is Anaya Allen. Number 4 is LeBron Allen.
Number 5 is Reginald Gabriel.
And number 6 is Anish Martin.
Okay. Good afternoon. Today I will be speaking about a current event that is very familiar to everybody, and that is the Michael Jackson death and the Dr. Conrad Murray case. Just an overview, Michael Jackson passed away about 2 years ago, June 25th, 2009, and his personal physician, Dr. Conrad Murray, has been on trial for about the past 2 months for the way they worded acute overdose of propofol. And basically, propofol is a drug that is only to be used in a hospital setting. It is only used in surgeries. It is not supposed to be taken out of the hospital at no point in time. It is not supposed to be given to anyone who is not going into critical care or getting ready to have a major surgery. Drugs.com states that propofol is mainly used to keep patients in ICU who are really sick and can become like violent, I guess, when they're trying to get tubes or get them hooked up with IVs. Propofol is used to sedate them and keep them calm. At the same time, they have to watch their heart rate because propofol can cause a person to go into a coma depending on how much you give them, and it's what it could cause death because it causes your heart to be slow. It causes your heart rate to slow down. So in that case, if you give a person too much, their heart rate will slow down enough to where it won't beat at all. They stated that Michael Jackson was on other drugs and other prescriptions that were given to him by Dr. Conrad and by another personal physician whose name they won't put out. They have talked to Dr. Conrad Murray and all the accusations of him overdosing Michael Jackson or giving Michael Jackson illegal drugs and other things like that. Dr. Murray has declined all accusations. He has stated that he has abided by medical law, that he has not done anything wrong at all. He did not cause Michael Jackson's death as well. There's other drugs and other doctors who have given Michael Jackson medication that he did not know of. As well, there were witnesses throughout the case that stated that sometimes Michael Jackson would give an IV to himself of the propofol when he was having a hard day or hard time, or he would have Dr. Conrad meet him down in the hobby once he get home from a hard day or having a hard time, and have Dr. Conrad give him the propofol. So that's the main point that everybody's trying to point on, that Dr. Conrad is responsible. And then basically, in my opinion, I don't think Dr. Conrad should be charged with Michael Jackson's death due to the witnesses saying that Michael Jackson would give the propofol to himself. But I do believe that Dr. Conrad Murray should be charged with having such medication outside a hospital setting. He should be charged with ordering the medication in such large quantities when there's no surgery or Michael Jackson's not critical care. He should be charged with that. That's why I think his medical license should be taken away, because he's not abiding by the medical law, which is to protect your patient in any way possible. You're supposed to make them better, not cause them to have an addiction. And I think that's what Dr. Conrad Murray did, was cause Michael Jackson to have an addiction to propofol, and that led him to, I guess you would say, having an overdose, because they stated on June 25th that morning, Dr. Conrad had gave Michael Jackson so many milligrams of propofol, and Michael Jackson went back in the room and gave some more to himself. And so when the paramedics came in, they saw an IV still hooked up to Michael Jackson's leg. There were oxygen machines everywhere. And as well, I don't know why this was stated throughout the case, but there was a China doll in the bed. I don't know what that has to do with the case, but they were stating that that's how addicted, or that's how bad Michael Jackson had gotten because of propofol, that he was playing with dolls and stuff like that. So basically, my opinion or my overview of this whole case is just that Dr. Conrad is guilty of, I would say, giving Michael Jackson the drugs. So If anybody has any questions or they would like to state their own opinions about the case, or if you want to ask me anything, I do have some articles here from the Los Angeles Local Times, and they talk about, even though he's on trial, Dr. Conrad is trying to do interviews. He has a documentary coming out at the beginning of the year called Michael Jackson and His Personal Physician, as well on BBC. This goes like an overview of how Dr. Murray started out becoming a doctor and his success, because he's a very well-known doctor in LA and as well in Texas. So I just, if you guys want to look over that, but I just thank you for listening to me and, just letting me express my opinion about this case. Does anybody have any questions about this particular case?
I have a question. As a recreational therapist and as a care provider, we do take oaths in taking care of our patients / residents, depending on the setting. Being that Michael Jackson was in a home setting, and yes, Dr. Murray did leave the IV there for Michael Jackson to use. At what point, when he did take the oath and take the creed as a doctor, I'm quite sure he explained to Michael how the drug worked, when to take it and when not to take it. So when he walked out of the room, do you think that he already knew Michael Jackson was an addict, and do you think that he should have continued to give it to him? And why wasn't Michael Jackson rushed to an emergency room? And fourthly, why wasn't Michael Jackson encouraged to go to a rehab?
Basically what they were saying, they didn't know Michael Jackson was addicted to drugs. He wasn't rushed to a hospital either because they pronounced him dead when they got there, because Dr. Conrad supposed to do CPR, and it stated in LA Times when the EMTs arrived there, Dr. Conrad even told them that Michael Jackson was taking propofol, and he admitted that he did do the CPR wrong, so that could have caused Michael Jackson's death.
Thank you.
Any other questions?
So, is Dr. Conrad in jail right now?
Yes. On November 7th, he was found guilty of involuntary manslaughter due to a prescription. He will be sentenced on November 28th, and right now he is incarcerated without bail. So he can't go out and do any other interviews or anything like that. Any other questions?
Yes. I don't think Dr. Conrad Murray should be jailed because he took care of a lot of people and he did the best he could do for everybody. With money or without money, he still waited on patients. And I think he should just do community service or something like that.
Or probation.
Or probation.
Yeah. Probation, yes. Okay, well, I just thank you guys for your questions. I thank you guys for your opinions about this case. This has been a very long case for everybody, including Michael's family. So, in all, Dr. Conrad is facing involuntary manslaughter. He will be sentenced on November 28th. He's looking to face 4 years in jail, as well as have his medical license taken away. So he won't have any more medical office. He will not be a doctor anymore in any state of the United States. So that's his life. Thank you.